Good evening, everybody. Welcome to Rehabilitation Science Group. Today, we are discussing having symposium on low back pain. We are having the esteemed panelist with us. I would like to invite our panelist, Dr. Manish Arora, sir, Dean, SBS University, Dehradun. Sir is pioneer in physiotherapy. Thank you, sir, for coming in our panel. We are having
Thank you,
with
sir.
us
Thank you, Shagun.
Dr. Anand Mishra, sir, Registrar, Arvindo University, Indore. Thank you, Anand Mishra, sir, joining with us.
Thank you, sir. Thank you very much.
We are having with us Dr. Devender Kumar Trivedi. He is Associate Professor in IMR. Thank you, Dr. Devender.
Thank you, sir.
We are having with us Dr. Kruti Mehta. She is Senior Consultant Physiotherapist in Mumbai. Welcome, Dr. Kruti.
Thank you, sir. Thank you.
We are on today's with the myths and facts about the low back ache. So we are having a esteemed panelist with us. I would start with this. Low back ache is the most common orthopedic conditions which we see in physiotherapy. And according to the facts, 80% of the population, they suffer from low back ache in their any time of the life in their lifetime. Okay, so I would start with our senior most Manish sir. Sir, what do you think about it's a common problem. Still, we are not able to find out the exact diagnosis and the exact treatment. So where we physios are lacking. Sir, just give us light on this thing.
Sure, sir. Shagun, sir, before I go ahead, let me thank you along with Dr. Haran and Dr. Harpreet for letting me be here to speak to many of your rehabilitation group followers. It's a great honor for me. Well, I think the problem is not there's a lacuna in understanding low back pain. The lacuna is that we have been using everything like a paracetamol. The paracetamol works even if you have typhoid. It also will work to decrease the fever when it is with malaria, corona, dengue, anything. But it does not cure it. It's just a pain. It's just a symptomatic reliever. It just brings down the fever. The same thing, low back pain is not a condition. It is a combination of many different things which brings dysfunction to your back and presents as pain. So what we need to first find out is the exact cause. Like in malaria, you find out that you require quinine because the parasite requires that. In typhoid, the bacteria requires an antibiotic. So similarly, when you have low back pain, you need to find out what articular structure is involved or what particular muscle is overfiring or underfiring, what is presenting with symptoms. It could be not only the muscles and the articular system, it could be the viscera which will be communicating to the low back pain. It could be, it's a whole Pandora box of things which need to be opened up and actually they need to be opened up to provide more holistic, more uh, a curative relief to the back pain, not rather just hiding the symptoms and making the patient go happy and after 10 days the patient walks back to the same problem. So we need to find things and we need to find really in quick terms because in India we don't see about 7 or 8 patients as in Western world they do. They only see that number of patients because the patients pays them so heavily. In India, we are treating masses. There are therapists who see about 100 patients a day, of course, with the help of others, not single-handedly. But then we need to find those things very, very quickly, have to provide a quick solution so that we can manage them in a more effective way, but with a very, very accurate diagnosis. So that's the thing. We need to enhance our skills in finding those things first, the diagnosis, and then we can offer a more permanent cure to the solution.
The thing is that our physios should have a accurate diagnosis and then they should pursue about their treatment is there. That is the main summarization is there. There we should be more focusing. So I am coming with to the Dr. Anand Mishra sir. Sir, you are working a lot onto the core muscles. So what is the role of this core? That's why I mean, as Manish sir has said, we should find out the diagnosis, then the exact treatment, just like means we are giving paracetamol for everything, every condition. So that's why we always say there is a requirement of core is there. So what is this core is there?
Sir, the core, again, as Manish sir has said, rightly said, that this is definitely a issue. We start treating back pain without knowing exact cause. We are having our traditional methods of treatment in physiotherapy, and I'm sure that we are getting the maximum number of patients for the spinal problems, low back pain or cervical problem. And we start with the routine one without understanding what exactly issue is. So if you go to the pathology or the problem behind the actual problem behind the back pain, then you will find that whenever there is a problem in the stability of spine, body is having its own mechanism of balancing outer forces and your own body force also. So now we are having a lifestyle where we are giving a stress or we are giving an undue stress to one component and our second component is being kept in the shortened position. That creates the imbalance. Now I'll come to the what is exactly core. So core, if you, I always try to give this example, to take a Coca-Cola can or a soda can. So it is a closed chamber. The body has to maintain balance between that chambers, all chambers. You say the roof is diaphragm, the anterior side is the rectus abdominis, transverse abdominis on the both side, and the back side, the multifidus, if you say broadly. There are actually 29 muscles which are responsible for the maintaining core. So the major role of core in the body is to maintain the alignment of spine by keeping the adequate pressure on it. Now, if you see the spine, spine is not a bamboo spine. God would have given us a bamboo and we'll not be having any problem of instability or hypermobility or lack of mobility. It could have been fixed. But to give you more mobility, God has given us a spine with a small components. And these components are basically stabilized by core. So if you work on the core, you can maintain the proper alignment posture of the body. That will definitely help in reducing the chances of back pain. I'll say before treating, you can prevent itself. So if I'll just, Sagun sir, if you are standing and if I come and push you, what your body will do? You'll try to hold your body at place. So similar thing is happening. Your cores are getting activated like that. So whenever we are treating core back pain, the core is definitely a major component to be targeted.
But the thing is, a lot of physio says, okay, go for only spinal extension exercise. Means everybody is going for to the spinal extension. So I'm thinking we are missing abdominal exercise, core we are missing, or that should be added in our exercise program, because a lot of physio, they focus on the only in the spinal extension.
Sir, definitely I do agree with you. Now the issue is the spinal back pain is always been considered that you are having a flexion posture and you are getting a problem of that. Give it an extension. And if you say that our traditional therapies will also say like this, do the Bhujangasana or something like extension. But if you just take an example of spondylolisthesis, where that is going to create a major harm to your spine. So proper evaluation and finding out the cause of back pain is most important before treating, because sometimes your flexion exercises are more important than your extension exercises. And again, that component, if you see the Coca-Cola can, as I said, if you open it from top, that can is not having any strength, but till it is been closed. So you have to have all the walls to be targeted properly. It is not that if you just only target on the extensors, you will be preventing back pain. No, it is going to misalign your body. Again, it is going to create more problem, because your body, where muscles are more strong, they will pull the body on that side, and other muscles will be getting lengthened. Lengthening and shortening both are creating muscle weakness. If we remember our first year and second year of BPT, the optimal length is required for that.
Thank you, sir. Thank you. Devendra sir, coming to you. Sir, you are working a lot of the things onto the motor control. So every time we think motor control is about to your neuro things and all these things. But what do you say about the motor control in the case of the low back pain?
Thank you, sir. Actually, I totally agree with Dr. Arvind and Dr. Manish, sir. Actually, हमारे क्लिनिक्स में डे टू डे प्रैक्टिस में बहुत सारे पेशेंट ऐसे आते हैं तो हम जितने भी फिजियोज हैं, जो स्टूडेंट्स हैं या जो भी प्रैक्टिशनर्स हैं, वो उसमें अपना जो भी इलेक्ट्रोथेरेपी मोडलिटी यूज करते हैं, जो भी एक्सरसाइज यूज करते हैं, मैनुअल थेरेपी यूज करते हैं, तो इन सम केसेस जो एक प्रॉपर डायग्नोसिस, जैसा मनीष सर ने बोला कि प्रॉपर एक्यूरेट डायग्नोसिस बहुत रिक्वायरमेंट है, तो मोस्टली क्या होता है कि हम हाइपरमोबिलिटी को ज्यादा फोकस करते हैं कि ये रेंज ऑफ मोशन रेस्ट्रिक्टेड है, पेशेंट मूवमेंट परफॉर्म नहीं कर पा रहा है, ये रेंज ऑफ मोशन रेस्ट्रिक्टेड है, लेकिन कहीं ना कहीं वो हाइपर मोबिलिटी पे वर्क बहुत कम करते हैं। जैसे कि अभी सर ने बताया कि हाइपर मोबिलिटी मीन्स जो कोर मसल्स हैं, तो कोर मसल्स में जैसे कि आपका डायफ्राम है और पेल्विक फ्लोर मसल्स हैं, ट्रांसवर्स abdominal मसल्स हैं, मल्टीफिडस है। तो मल्टीफिडस इज एक्चुअली में सेगमेंटल स्टेबलाइजर, जो मल्टीफिडस सेगमेंटल स्टेबलाइजर है। तो जब भी हम क्या करते हैं कि इसका प्रॉपर असेसमेंट नहीं करते, और जितने भी क्रोनिक बैक पेन के पेशेंट्स हैं, एक्यूट में तो सिम्टम्स पेशेंट लेकर के आता है कि मुझे जंपिंग साइन है, टेंडरनेस है, सारे सिम्टम्स लेकर के आता है, लेकिन जो क्रोनिक पेशेंट्स हैं, यानी मोर देन 3 मंथ, यानी 3 महीने तक जो पेशेंट पेन बियर करते रहते हैं, या फिर जो अकॉर्डिंग टू हीलिंग टाइम के बाद भी पेन परसिस्ट करता रहता है, लाइक साइकोसोमेटिक डिसऑर्डर्स है, वो भी पेशेंट जो होते हैं बैक पेन के साथ में आते हैं। जितने भी तो हम क्या करते हैं, कहीं ना कहीं इसको अनसीन करते हैं, जो भी कोर स्टेबलाइजर्स हैं। तो अगर इनकी प्रॉपर डायग्नोसिस करें, यानी हाइपोमोबिलिटी के साथ में हाइपर मोबिलिटी पे भी फोकस करें, तो हम कहीं ना कहीं कभी कभी क्या होता है कि हम ट्रीटमेंट देते हैं लेकिन पेशेंट प्रॉपर रिकवरी नहीं होती, तो फिर हम टेक्निक चेंज कर दें, कभी ये टेक्निक वो टेक्निक अप्लाई करते हैं, लेकिन हाइपोमोबिलिटी बहुत कम वर्क करते हैं। हाइपोमोबिलिटी एक मेन रीजन है, जैसे कि मनीष ने बोला कि विसरल में तो बहुत सारे डीजे जंक्शंस हैं और ये इंटेस्टाइन है, ये सारे के सारे जो होते हैं रिलेट करते हैं बैक पेन से। जब भी एक स्ट्रक्चर होता है, मैं एब्डोमेन को बोलते हैं फेशिया, जो कि पूरी बॉडी में होता है एक्चुअल में, तो फेशिया की बहुत सारी कहीं कहीं स्ट्रेंथ हो जाता है, इसमें बहुत सारे डिस्फंक्शन हो जाते हैं, इसकी वजह से बैक पेन होता है। कॉज होता है एब्डोमेन में, कोर मसल्स में, कोर ऑर्गन्स में, और जो सिम्टम्स होते हैं वो बैक पेन सोर्स होते हैं। तो एक एक्यूरेट डायग्नोसिस इज वेरी इंपॉर्टेंट फॉर ट्रीटमेंट ऑफ बैक पेन, chronic low back pain.
Thank you, Dr. Devender. Now coming to on Dr. Kruti. Dr. Kruti is working a lot of work on the dry needling.
Yes,
Ma'am,
sir.
a lot of physios get confused. Is it dry needling? Is it similar to the acupuncture? And exactly what the role of the dry needling in low back pain is there?
So first of all, many thanks to call me here. And apart from physios, a lot of patients also have this confusion that whether dry needling is same as acupuncture or is it different. So a lot of time acupuncture and dry needling are lumped together. Why? Because we use the same kind of thin filiform needles, so same needles are used. So that's why they say that the acupuncture and dry needling are same, but it's totally not the same. Acupuncture is based on the tenets of ancient Chinese medicine, while dry needling is based on the Western medicine. Okay. So in acupuncture, they put the needles on the Chinese meridians. But in dry needling, we actually assess the muscle, which muscle is inactive, which muscle is overactive. The same thing we have to first assess, whether it is an underactive or an overactive, whether we need to inhibit or whether we need to facilitate the muscle. And just on the basis of our assessment, on the basis of our subjective assessment, we put the needle on that very muscle to improve its efficiency. So we work on the trigger point, the primary trigger point of that agonist or an antagonist muscle, and we improve the muscle efficiency, we improve the movement of that very area.
So, Dr. Kruti, are you finding it that dry needling is quite safe for low back pain?
Yeah, dry needling. So basically, in low backache, there are a lot of risk factors because we have organs under the low backache. Okay, so under the low back. So basically, we have to choose the right size of needle. We need to know the anatomy, and we have to insert the needle in a right angle. So only then it is very safe. Absolutely safe to use dry needling in low backache. But again, it's not just a primary treatment. We have to use it in adjunct to the regular physiotherapy exercise. Nothing can substitute the exercise. But yes, it gives very quick results and a very long lasting results that I've seen in my clinical practice.
Thank you, Dr. Kruti.
Thank you.
Uh, Manish sir, I am coming to you. There are a lot of myths are there. He means ki exercise sometimes can aggravate the back pain, and pain is always from the injury is there, and always they say you should go for the bed rest. Is it something like this, sir? Ki bed rest is the only option?
Yes, sir. If we live in Stone Age, definitely it is the answer. Uh, because this is the old theory. Now the
Yeah.
theory is motion is lotion.
Yeah.
So the more you move, I remember it seems like ages, but it's not so far. Only about 30 years back, when we were at NISAR, I used to see orthopedic surgeons prescribing 3 months of bed rest for people with disc herniation, people with flared abdomen. They'll put a traction with a little weight on the bed, and people will be put onto that kind of a thing. But then, as I said, it's an age-old practice. This had to be thrown away. We needed to incorporate something which not only takes care of the pain very early on in this fast-aging world, fast-moving world, where nobody has time now to even come to a clinical for, treatment for about 8 to 10 days. They want very quick results. But not only for the pain, but also for restoring the function, as Dr. Anand said, and it was emphasized by Dr. Devinder. If you are going to do that, your core muscles are further going to weaken up. As such, the core muscles shut down very early with the dysfunction, and if it is coupled with inactivity, they are not going to work, and you're going to fail in the final outcome of the patient to be brought back to his functional ability. So the motto which we all should have is to send his back to work rather than stopping his back from going to work. So we should target those things where we could provide some optimal rest to those cases where there's an injury and we want the tissue to heal. And that's a very short and optimal period. And in cases where the dysfunction is coming from tighter of the muscles, we need to put the muscles uh, into the optimal length by releasing them. If it is because of weakness of core muscles or certain muscles, we need to get them better. If it is because of hypermobility, we need to find out that hypermobility and manipulate. We cannot just use the manipulation for anything. It's not that one size fits all. It has to be very, very specific. The problem, which today, with the advent of this YouTube channels and the social media, is you see certain people manipulating without evaluation, without doing anything, and they do manipulation for anything. Definitely, that manipulation temporarily gives you a very soothing and relaxing effect, but that doesn't cure unless the structure which is gone out of fault is manipulated back. So we need to identify whether it's core, whether it's a trigger in a muscle where, as Dr. Supi said, we need to put a needle there, or it's a hypermobile segment which needs to segment to stabilize it. So it all depends, but we definitely need to start the rehabilitation program from day one, and it should be more of a functional one without taxing the patient of losing his work too much.
Thank you, sir. You have taken my words, because I was coming to this question only because nowadays every physio wants the cracks. There should be some sound should be there. And the patient is also get fascinated by the crack sound. Okay, oh, sound has come, now I am going to improve. So means the thing is it should be only in the corrected way.
Yes, it needs to be really very, very specific. You need to specifically find that and correct it. Otherwise, selling things are not that difficult in any place. Uh, I remember there used to be a cream called Fair and Lovely with all due respect to the manufacturers of that company.
Yeah.
It never made any person become whiter, but it was sold like for millions.
Yeah. So means we shouldn't means if there is a crack is there, definitely there would be improvement. So firstly, we should be having our fundamentals. Concept should be correct, and we should follow the pathway of fundamentals.
Absolutely, sir. Absolutely.
Coming to Dr. Anand Mishra, a quick review key means key. Just tell me the few tips to how to improve our core. If we are in the sitting posture or if we are into the working habits are there. So just give me a quick review key. Okay, sir, do these things. This would activate your core.
Sir, activating core is, I think, the most easiest way. just if you are standing with a proper posture also, it is going to activate your core muscles. The thing if you realize your posture, if even myself, I'm having now a big tummy, so that is creating a alignment deficit, and that definitely give a load on one side, and another side it is creating a lengthening. So if you want to activate your core, there are very simple exercises. If you just indraw your abdomen, take it like just when we are just getting a wish of urination and you don't find any good place, you are holding it tightly. That maneuver also gives the activation of your core. If you just simply stand and gradually raise your hand slowly, slowest possible way, the disturbance in your posture will definitely activate your muscles. So by this you can activate your core very easily. And there are definitely few exercises that can be used with the help of Swiss ball. Basically, the core is interlinking between the lower extremity and upper extremity. So any movement at the upper extremity and lower extremity will also give a load on core. But the basic concept in core stability is the therapist or a person should know exactly in what correct posture they have to do that. That is the most important thing, because activity we are doing, if you ask a housewife, she will say that every day I'm standing long for roti banana and I'm doing this, that, but in a wrong posture. So you are facilitating the wrong activation of muscle. That the only thing is you have to correct in a proper posture and do any activity in upper and lower extremity that will help in your activation of your.
So we have to take care of our tummy is there, but the Indian foods are so delicious that sometimes we overeat. Okay.
Sir, I'll just go away from the discussion. Indian thali, if you remember, that is having everything, sir. We have forgotten that. That was having fat, that was having protein, that was having fiber, that was having probiotics, everything. So now we are in shortcut of getting a Lapino's pizza.
Yeah. So we should come to our traditional parties there.
Yes,
Yeah,
yes, yes.
definitely.
Sir,
So,
I'll tell you
Dr.
one very
Yeah.
easy exercise. When you are sitting cross-legged on floor, if you just try to stand up without any support, that will activate your all muscles, including core. You just
Thank you,
sit
sir.
on the
Thank you.
floor
Thank
in
you.
the cross leg,
Yeah.
and
Yeah.
without any support, just try to stand up from there. And you will find
Okay.
that your all muscles are getting activated.
Thank you, sir. That would be a magic trick for activation of the core. Dr. Devendra, sir, just means you have discussed about the fascia and the motor control. Few rotational exercise you could tell means what would be the good for the low back pain.
ओके सर. सर ये रोटेशनल एक्सरसाइज से पहले मैं थोड़ा सा बैक जाना चाहूंगा. जो अरविंदो सर ने बोला भी मोटर कंट्रोल एक्सरसाइज के लिए, एक्टिवेशन के लिए टिप्स देना चाहूंगा जो स्टूडेंट्स इसको देख रहे हैं हमारे इस वीडियो डिस्कशन को. एक बहुत ही पेक्यूलियर टिप्स है कि कैसे हम असिस्ट करेंगे कि हमारा जो कोर जो मेजर स्टेबलाइजर्स है वो वीक है. उसका सबसे सिंपल एक तरीका है कि जैसे कि मैंने बोला डायफ्राम, फर्स्ट डायफ्राम जो कि अपर पार्ट ऑफ द कोर पार्ट है, कोर मसल्स का पार्ट है. तो सबसे पहले क्या, अगर पेशेंट हमारे पास आता है और कंप्लेन करता है कि मुझे बैक पेन है, यानी फॉरवर्ड बेंडिंग मुझे बैक पेन है, ठीक है, तो पेशेंट से हम क्या बोलेंगे स्टैंडिंग पोजीशन में कि टेक अ डीप ब्रीथ एंड फॉरवर्ड बेंड. अगर डीप ब्रीथ करने के बाद और पेशेंट फॉरवर्ड बेंड करता है, अगर पेन उसका रिड्यूस होता है, तो मीन्स वर्क ओवर द डायफ्राम. ओके. एंड सेकंड है, अगर इसके बाद सेकंड आता है ट्रांसफर एब्डोमिनिस. तो ट्रांसफर एब्डोमिनिस चेक करने के लिए क्या करते हैं, पेशेंट से स्टैंडिंग पोजीशन में बोलते हैं कि ड्रॉ इन योर लोअर एब्डोमेन. मीन्स जो अपनी पैल्विक टिल्ट है उसको पोस्टीरियर टिल्ट करो, यानी एब्डोमेन लोअर एब्डोमेन कॉन्ट्रैक्ट करो. ठीक, कॉन्ट्रैक्ट करने के बाद बैंड करो. अगर पेन रिड्यूस होता है उसका, तो यानी हमें वर्क करना है ट्रांसफर एब्डोमिनिस पे. थर्ड है पेल्विक फ्लोर मसल्स. पेल्विक फ्लोर में क्या बोलना है, पेशेंट स्टैंडिंग पोजीशन पे खड़ा रहना है और पेशेंट में बोलना है कि यूरिन फ्लो है, जैसे उसको हम कंट्रोल करते हैं, उस यूरिन फ्लो कंट्रोल की जो प्रोसीजर है उसको परफॉर्म करें और बैंडिंग करें. इसमें भी पेन रिड्यूस होगा अगर उसकी पेल्विक फ्लोर मसल्स वीक हैं. फोर्थ है जो मेन है वो है मल्टीफिटस. तो मल्टीफिटस हम क्या करते हैं, एक्टिव उसको असेसमेंट करने के लिए पेशेंट स्टैंडिंग पोजीशन में होता है और पेशेंट से बोलते हैं कि जो अपना स्पाइन है उसको एक्सियल कंप्रेस करे, यानी कोई मूवमेंट नहीं होना चाहिए, सिर्फ स्पाइन को एक्सियल कंप्रेस करें, ऑक्सीपिट को डाउनवर्ड पुश करे. जैसे वो पुश करेगा उस पोजीशन में उसको फॉरवर्ड बैंड करना है. बट इसमें क्या है कि अगर वो मूवमेंट रजिस्ट कर रहा है, क्योंकि जो मल्टीफिडस है वो सुपरफिशियल और डीप होता है, सुपरफिशियल और जो डीप मल्टीफिडस है वो स्टेबलाइजर का वर्क करता है, सेगमेंटल स्टेबलाइजर, ठीक है। इरेक्टर स्पाइनी जो कि इसेंट्रिक मसल्स है, अगर ड्यूरिंग कॉन्ट्रेक्शन ज्यादा स्ट्रॉन्ग कॉन्ट्रेक्शन करेगा तो इसेंट्रिक मसल बेंडिंग को ऑब्स्ट्रक्ट करेगा। तो मिनिमल 10%, ओनली 10% कॉन्ट्रेक्शन एंड देन परफॉर्म द बेंडिंग मूवमेंट। अगर पेशेंट बेंडिंग मूवमेंट पेन को रिड्यूस फील करता है, कम फील करता है, तो यानी उसको मल्टीफिडस सिस्टम को वर्क करना है। इसको हम कम एक साथ सुसिट भी कर सकते हैं कि डीप ब्रीथ, इंड्रॉ योर लोअर डोमेन, कॉन्ट्रैक्ट पेल्विक टिल्ट एंड कंप्रेस द स्पाइन एंड बेंडिंग, तो टोटली सिम्टम्स डिसअपियर हो जाते हैं। अगर टोटली सिम्टम्स डिसअपियर है तो हमें पूरा वर्क करना है एब्डोमिनल कोर स्टेबलाइजर्स पे। फिर जो अभिनव सर बताया उसके हम
बहुत ही अच्छा, मतलब कि सर आपने बिल्कुल ही क्लियर कर दिया कि किस तरीके से हर मसल्स को हम पूरा का पूरा डिफरेंशियली एक एक मसल को अलग निकाल सकते हैं। वेरी गुड देवेंद्र जी, बहुत थैंक यू।
उसके अकॉर्डिंग हमें ट्रीटमेंट करना बहुत बेटर रहता है।
थैंक यू सर। Dr. Kruti, there is a fascia is everywhere, and we physios are dealing with the fascia. So, what is the role of this dry needling in fascia, in the low back pain, the thoracolumbar fascia? Yeah.
So first is you cannot separate fascia and muscles separately. Okay, if you are manipulating L1, you can't say that there is no movement at L2. So basically, whenever you are releasing the muscle, you are releasing the myofascia component as a whole. You cannot say that I'm releasing a fascia and I'm not releasing the muscle. First of all. Second, dry needling works on the trigger points. Okay, so there are arsenal tools available for physiotherapists to release the trigger point. Like ISTM hai, cupping hai, but dry needling is also one of them. So what we do basically is we look for a trigger point which is hampering the muscle activity. We take the needle and we hit that very trigger point to obtain a twitch response. And we stimulate that trigger point so that it promotes healing and the muscle gets active faster. Now in low backache, just like how the Devendra sir said, multifidus is a very, very deep muscle. Okay. And it is also a very good stabilizer. It is active in rotation, extension, and it gets active in almost all the activity. So it is very difficult to isolate this very muscle. But with dry needling, if you feel that multifidus is inactive, okay, with dry needling we can go straight into the multifidus, hit that muscle and bring back into its action. So, and if so, this is just one example, like how we target multifidus for the low back pain. So that's how we go about it.
Oh, thanks. So nice of you.
Thank you, sir.
Dr. Kruti. I am coming to Manish sir. Manish sir, kindly summarize the things, because now I would like to say that the myth is if you go to your spinal surgeon and then he is going to say for the surgery. So is it fact or it is just a myth, and we physios can control it? Kindly summarize the things.
Yeah. Now, the last thing I would not like to comment on a public platform, because that's their job, and probably they are happy doing the surgery, putting knives on people's body, and probably at times that is very, very important because sometimes it could be life-saving when you have cancers, when you have sequestered this, which can really bring a lot of pain. And all of the things, they have their own role, but most of the time, I think we can really stop the patient from going to the surgery, because if we do the right kind of intervention, we can save a lot of surgery, which definitely saves the patient from the pain and trauma undergoing a surgical procedure, the family going under financial trauma, and definitely probably surgery may not be solution to everything, because if your posture is going to be bad, if muscles, core muscles are not going to function properly, it's going to be one this, the other this may start coming from other areas. So we need to really find the right structures which are involved. We need to treat in the right way, as everybody said, all the life analysts here. We were really quite emphatic about their the roles of the important things we talked about, and this actually means a lot to the patient. saving from a trigger point pain, saving from hypermobile segment, or let it be dysfunctional core, or let it be orthopedic chiropractic, where we need to adjust the bone and fix it back into position. So everything has got its own importance, and put all together, finding the right fall, giving the right treatment, we can only say the patient is going to really live his life to the child. He's not going to go down on the bed and cry and keep on looking for different options between. But if the right treatment is provided, I think the solution will automatically come to the patient.
Thank you, Manish sir. Thank you. So from the Rehabilitation Science of Group and from the Institute of Applied Medicines and Research, IMR, I would like to thank our all the allied panelists, Dr. Manish Arora sir, Dr. Anand Mishra sir, Dr. Devender, Dr. Kruti. Thank you for coming on this platform and giving information to all the professionals and the students. And what the key I could find it out is, first is Manish sir, diagnosis sir has said, as Anand Mishra sir says, there should be the core muscles, and Devendra sir has said about the fascia, and the accurate muscles should be diagnosed, and with the technique of the dry needling and the new techniques, we can treat it. And definitely, we physios are going to fly, and every patient is going to be treated by the physiotherapy, and they would be happy. Thank you all. Thank you for giving your
Sir,
opinion.
I'd like to wish your team for a very huge success for the upcoming NeuroX's event that you're organizing.
Thank you, sir. Thank you,
I think
sir.
it's in next month.
Yeah.
And I was so happy that Fisher, who is also a wonderful practitioner in fascia, is going to be there in that conference. So
Yeah,
I wish
definitely,
you
sir.
all a lot of success to your entire team, and definitely looking forward to that event.
Thank you, sir. Thanks a lot. Thank you. Thank you all. Thank you all.
Thank you, sir. Thank you very much.
Thank you.
Thank you, sir.